colors of the gingiva was out of the textbook, quote unquote, coral pink. But in 1946, a group of faculty spearheaded by our dean at that time, Dr. William H. Allen, postulated that culturally, all patients don't have coral pink gums. So they formulated at that time a new acrylic that would more match the melanin shade of gum tissue that you see in African American patients and other patients of color. They come to call this shade the Meharry shade of acrylic. Of course, there are many manufacturers that are making this shade now, and some of them give Meharry the credit for it, some of them don't. We all know that it is actually from the Meharry faculty that this shade was actually developed, and it's used all across the world, not just here in America, but it's all across the world. The School of Dentistry at Meharry was the first dental school in the country that included cultural competence as a part of its curriculum. We don't have 100% of our students being African Americans. We have a diverse student body, but every one of them will learn how to practice in communities, even those communities of which they didn't grow up in. But that started, of course, back in the 1940s when Dr. Allen and his group of faculty decided that it is better for us to be able to provide an appliance for a patient that most closely match their natural dentition. Throughout the history, you can go to any school within this institution and you'll find that they are all geared towards that one thing: serve the underserved.
So a PA is a licensed healthcare professional that provides medical care to patients. The PA profession was modeled after a doctor in rural North Carolina and his assistant, Dr. Amos Johnson and Henry Buddy Treadwell. Dr. Johnson trained Buddy Treadwell to take care of patients even when he wasn't present. He could do everything that Dr. Johnson could do. Dr. Johnson just happened to be friends with Eugene Stead at Duke University. And Dr. Stead got the concept of an assistant from the model between Buddy Treadwell and Dr. Johnson. And he took it back to Duke and he proposed it initially as a nurse practitioner program, and they shot it down. And he came back a couple of years later and they picked it up as a PA program. And this was supposed to provide an opportunity for Army medics that were coming back from the war to be able to get specialized training to be able to take care of patients. And so the first program, I think, started in 1967. There's a shortage of healthcare professionals, and PAs are going to help fill in that gap. And so when you put minority PAs back into our communities, you know, research has shown that you get better health outcomes for minority patients when they have providers that look like them. If you go back again to the history and the beginning of the profession that's only, what, 56 years old. It's a model that was based on Buddy Treadwell Johnson, who's an African-American male. When the profession first started, the profession was about 20% African-American, and now we're about 3.3% African-American. And Dr. Hildreth's mission with this program is to increase African-American males into the PA profession. So if we look at first-year matriculation rates for our inaugural cohort, the average matriculation rate for African-American students was 3.9% last year. Ours was 88%. Yeah, it's pretty impressive. Of that, 20% were African-American males. That's going to be our Meharry Shade. We are going to put back in the community providers that look like the people that we are going to serve in our communities.
I chose Meharry solely because I have a great history with it from my family. I believe I'm about the 18th person to go through Meharry. And my father, he also went to Meharry. Whenever I would visit him at work, or even if we were going to Kroger, he would be stopped by his patients and they would just give him praises for what he's done for them. And as a kid, it would get on my nerves because I wanted to spend time with my dad. But as I got older and as I too stepped into the shoes, now I see why he does what he does. I see why healthcare and the diversity in healthcare is so important. Whenever I started PPM, or Principles and Practices in Medicine, here at Meharry, they were very adamant about introduce yourself. Sit down when you see a patient and make sure that you're at eye level, that you're not intimidating them. A lot of our attendings will remind us about the possible cultural differences that we could come across, whether it be with our attire, how we address our patients, and we would get irritated with it at first, but now that I'm actually in the field and seeing patients on their level and meeting them where they are, I can definitely tell that they're more comfortable and they feel like I respect who they are and what they bring to the table. Because I know as students, we haven't seen everything, and our teachers really try to remind us of the differences that are there in the world, and they make us more prepared to help our patients. Being a medical student at Meharry, we have the opportunity of working in our student-run clinic called Salt Wagon. Every Thursday, we're open to the general public, whether you have insurance or not. We see people old and young, majority and minority people as well. We got to really interact with the people of our community and show them that minority in medicine is possible. I've really had the confidence to step into a room with any type of patient in any type of setting and feel like I can make a difference. The Meharry Shade I see at the School of Medicine is simply innovation. I know a lot of times whenever there is a need or a gap in the healthcare system, a lot of people see the gap, but they don't do anything about it. One thing that Meharry will always do is we act on a need. We don't wait. That energy, if anything, just feeds into the students. It's only made me want to be a better physician, make me want to be more aware of the patients that I'm helping, to really get to know them and to really be able to help them holistically and not just patch them and put a Band-Aid on it.
So the School of Global Public Health is charged with making health inequities history. And our mission will be to empower leaders who want to tackle the world's most pressing and complex health challenges. We want to catalyze solutions around the world. We want to unite scholars, leaders, learners of public health to come together to harness the power of collaboration to effect the kind of changes that will move the needle of health equity in the right direction once and for all. It'll be the first School of Global Public Health at an HBCU, the third nationally established in the United States. Our students, our learners, our faculty, our community members will have opportunities to learn how to navigate political systems and societal structures. They will understand the levers that have been pushed and pulled over time to either hinder or advance health equity in America and in other countries of the world. The School of Applied Computational Sciences will be a key partner, as well as the School of Medicine, the School of Dentistry, and the School of Graduate Studies. I think one of the things that attracted me to Meharry Medical College was knowing that these schools existed already and will be key partners as we conduct research, as we are conducting our scholarship, as we are going out into communities to serve. It's going to be a force to be reckoned with. Community engagement and community-based participatory research are just really critical to the work that we're setting out to do. The people who are closest to the pain and the problems of health inequities are the ones who should be leading the solutions. And that is a concept that we want to drill in every one of our stakeholders, ensuring that when we go into a community, we don't extract from the community. We're not just taking the data and then moving on and leaving them to now figure it out on their own. We are truly going to be partners with those communities, and we will sustain that partnership into the future. You know, Dr. Satcher has long reminded me that in order to be effective public health leaders, You first have to care about a community. You gotta care enough. You gotta know enough. You have to have the courage to do enough. And you have to persevere until the job is done. Those 4 elements of his principles on leadership are what I think we will draw into this new school as well. We first want to recruit people who care deeply. And caring means that you're going to have to learn how to be the most effective advocate for the population groups that you're fighting for. Meharry Shade is recognizing that a one-size-fits-all approach does not work, which is why providing equitable healthcare, public health services, data science research, and so forth is critical moving forward, especially as we become a more racially pluralistic society. Meharry Shade is going to add even more value to what is truly going to be a beautiful future